sector. Now, when you see the personnel, when you now have a situation in which the personnel that are supposed to run these particular sectors are moving out from, this country, in this particular case, Nigeria, they should call, for a conversation to say what is going on. How did we get here? What can we do to stem the tide of this exodus? Because it's really an exodus. And it's not a case of the government not being aware. They are aware, but government at all levels. And there are several indices to show that things are not good as far as the health sector in Nigeria is concerned. In fact, the exodus of especially the knowledge economy, those that run this particular, is not just about health, in education, people in tech, all of them, we call it Japa, there's a name for it, Japaing from these nations. But now we will not try to focus and narrow it down to the health sector. And several figures that is disturbing has been churned out. And the latest is what was said by the federal government, where they expressed concern over the alarming rate of emigration among Nigerian medical doctors, revealing that more than 16,000 practitioners have left the country for foreign employment in the past 5 years. And the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, disclosed this on Tuesday in Abuja during the 7th annual capacity building. That was 8 days ago, not yesterday. During the 7th annual capacity building workshop for the Association of Medical Councils of Africa, AMCOA, hosted by the Medical and Dental Council of Nigeria, NDCN, and addressing participants at the event themed Integrated Healthcare Regulation and Leadership in Building Resilient Health Systems. Professor Pate said Nigeria is currently facing an exodus of skilled health professionals seeking better opportunities abroad due to economic incentives, improved working conditions, and access to advanced training. And he put a figure to that. By the way, he talked about his experience. Reflecting on his own experience, the minister said, I, too, migrated in the early 1990s, and in 1993, I began at the MRC lab in the Gambia. The drivers haven't changed much since then. But then he put a figure to say 16,000 medical doctors have left within that period, this period under review. And then the Association, of Nurses, last week as well, came with their own statistics, and that is in thousands as well of these professionals, medical doctors, Nigerian nurses and midwives moving over, not just to the UK, but, to other countries of the world. Even as abysmal as our neighbors here, which might sound ridiculous to say, what do they have? What does the Ghana have? What does South Africa have, so to speak? We have two professionals in the house who are active in that sector. One has been at the helm of leadership of the NMA in Oshun before, Dr. Adedapo Adetoye. He joins us virtually. Dr. Adetoye, good morning. Good to see you again.
Good morning. Good morning, Nigerians. Good morning, Femi.
Thank you for joining us. And of course, somebody, I wouldn't know, possibly left on his own volition, a jackpot as well, Dr. Ayodeji Akonde joins us from the UK. Good morning. Thank you for joining us.
Good morning, Femi. Good morning, viewers at home.
Thank you very much. Let our charity start from home. We pick up with you, Dr. Adetoye. I remember severally we have had you on this program speak to other issues. Part of it is the brain drain. But now it seems the government are aware. The government of the day, they are aware. Or maybe you say they have always been aware. And the minister himself, who gave this particular figure to say 16,000 have moved out in the last 16 years. Is that an admittance of a problem, Dr. Adetoye?
Thank you once again. I guess so. And maybe his techniques are not working. Maybe that's why he's picking up now. Because we were at a stage when the federal government at that time felt Nigeria was producing a lot of doctors and there was no problem with exportation. And we now go to a point at which he himself, that is Professor Ali Pate, the Honorable Minister for Coordinating Minister for Health and Social Welfare, said it by himself that we shouldn't bother. That very soon those in the UK, like my brother here and some other people, will soon return home because of what he wanted to do. So I'm also shocked that he's saying this now. That's the reality on ground. That's the truth. Yeah, not only doctors. There's so many Nigerians of their own volition, because of one thing or the other, you know, they are moving across borders. And not even far, you know, I'm not talking about far places. Even some are moving to Cotonou here because the condition of service is better, the pay is better, relatively Ghana, you know. Let me put it this way. When you need something and that thing is very important to you, you tend to do more to get such. No matter what, I don't want to mention professions now. Nigeria should have gotten to a stage where the people in power should realize the fact that this is an emergency. We've always been saying it. You can't treat these doctors who are migrating like any other person. In every other country, you know, when you have a need for something, you create a special portfolio for it so that you can take care of the needs. Why are they leaving? We've said it over and over again. The condition of service. Imagine, look at my picture and that of my brother over there now. I'm running on alternative power supply where I am. Despite the attempt to illuminate my environment, it's still the way you are looking at it on the screen. So you will know why people are moving. When you get to the hospital and there's no power to start for the day, even yourself, your take home cannot take you home. It becomes a problem. And that's why people are migrating. How can people have invested so much into this training and all the likes, and they can't work, and where they can work, they can't even feed themselves, not to talk of us themselves. How would they not live? And this is what we are saying. Where they are going to, they are offering them something. See, this condition of service, this will be your pay, and they can see that it's better than where they are coming from. That's just natural for a human being. Somebody coming forward to come and plead, nationality, patriotism, and all those things. Are we serving under the same set of conditions? Are we? Equity. Equity is the thing. Give unto each person what the fellow should be given, what the fellow should have. Not that you be enjoying, you be pleading nationality and all the likes to other people. So that's the problem in Nigeria. We've said it over and over again. I hope at this point they can do something. They keep telling us about laws and laws. Well, they sit on laws and they can't make necessary amends that will make Nigerian doctors stay in Nigeria and work for Nigeria. Well, that is their fault. We have told them what they need to know.
All right, Dr. Adetoye. I'll start with you, Dr. Akonde, if you can hear me. Dr. Akonde, you are practicing in the United Kingdom. Before I proceed with my question to you, the Minister of Health, Professor Mohammed Pate, actually raised these concerns, not just this year, last year, on a television interview in March 2024, to be precise, when he said that Nigeria has about 85,000 to 90,000 registered doctors, but like 55,000 are actually working in Nigeria. He also raised concerns then that about 16,000, the same figure, had migrated to other countries within 5 years. Then he gave some worrisome statistics too. He said doctor-to-patient ratio in a place like Lagos, for instance, is about 2.2 to 10,000. That's what he said. So realistically, that should be 2 doctors to 10,000 patients in a place like Lagos. He said in Nigeria that places like Lagos and Abuja has a higher concentration of doctors. Lagos having 7,600 doctors practicing and Abuja having 4,700 doctors practicing. Now, you are practicing, Dr. Akonde, you are practicing in the UK. What is this situation like? This green picture we have here in Nigeria, is it the same over there? What exactly is the situation like? In terms of doctor-to-patient ratio.
Okay. Thank you for having me this morning. And let me start by saying this. I want to appreciate our colleagues working in Nigeria who have decided to stay in Nigeria to work. I want to say I salute them, I salute their courage, and I salute their doggedness. We really appreciate them because, of course, if everyone had gone, I can't imagine what would be happening in the country. Having said that, yes, it's a big problem, and I must say it's something that is really concerning to some of us, even who are practicing outside Nigeria. Here in the UK, the ratio of doctor to patients is not definitely as wide as we have it in Nigeria, definitely. But of course, it's still not enough. It's still not in keeping with what the WHO has recommended. And as we are having it in Nigeria, that doctors are moving out of Nigeria, I must say also that a lot of doctors are moving out of UK to other places like the US, Australia, Canada, and the likes. But I must definitely say it is not as, but it's a good one in the UK, not in any way close to how bad it is in Nigeria. I must say it is a very, very bad one, and it is aching to the heart, really. Looking at this news, hearing from colleagues who are working in Nigeria, because of course we are always in touch with our colleagues, and the news is not palatable at all.
All right, Dr. Akonde, just before you proceed, according to data documented by the Development Research and Project Center, DRPC, Nigerian doctors moved to the UK in 2015. I'm trying to give you some figures of Nigerian doctors who moved to the UK alone. Now, in 2015, we have about 233 Nigerian doctors moving to the UK in 2015. The number increased to 279 in 2016. In 2017, the figure was 475. And in 2018, the figure rose to 852. In 2019, it jumped to 1,347. In 2020, the figure was 833. And in 2021, it was 932. These are figures of Nigerian doctors who have moved to the UK alone, practicing in the UK, over 5,000 doctors. The question is, why is it happening like that? Dr. Akonde, do you think Nigerian doctors are not being patriotic enough? And I'm going to give you this example, Dr. Akonde. I met with someone, I had a conversation with a consultant rheumatologist at the Lagos University Teaching Hospital some time ago. And he told me that he's still in Nigeria because he is patriotic. He said, as a consultant rheumatologist, he was earning about 650,000 naira at that time. He said he could earn better if he should migrate to the UK. But because he's a patriotic Nigerian, number one, that is why he is staying back in Nigeria. And he also gave me another striking reason why he stayed back. He said for his field, he said for rheumatology, that there were only about 4 of them practicing in Nigeria. But he said that in the UK, for that same specialty, that there are over 4,000. So according to him, he said if he should go to the UK, that it would just be one out of many doctors, that he sees himself being of more valuable service here in Nigeria. So Dr. Akonde, do you feel that a lot of doctors are actually moving away because they are not patriotic enough? These doctors have been trained in Nigeria. Medical training in Nigeria is highly subsidized, Dr. Akonde. I mean, highly subsidized compared to, if you compare figures, cost of training doctors all over the world, you will discover that medical training is highly subsidized in Nigeria. Now, doctors get trained in Nigeria. After their training, they abandon their country to move to other countries for greener pasture. Don't you think that Nigerian doctors are not being patriotic enough?
Yeah, thank you for that question. And I think I've had this argument with colleagues about patriotism. And I want to say it's not really about patriotism per se. And I will give you an example. Let me use myself as an example. Before I left Nigeria, I've practiced in Nigeria for about 13 years in Nigeria before I left. And something happened around 2016, thereabout. I was working in Osun State. And that was the time Governor Adegbeshola was the governor. And for a whole year, I think for about 9 months consecutively, I was not paid. You know, it was the era of the half salary and stuff like that. And it was really chaotic for me. You know, you could imagine a doctor not being able to take care of immediate needs, the lowest part of the hierarchy of needs. And that was the point I actually took this decision. I started brainstorming on the way out. Of course, I didn't leave immediately, but I started strategizing on how to escape from that kind of situation. Because I knew if such a thing can happen for once, the possibility of it happening again is very high. And I never wanted to find myself in such a situation again. So I would say it's a matter, it's a function of patriotism, really. It's about you yourself, you want to survive, you want to live a good life for yourself. And that's the way I want us to see it. Another thing is that, see, the job of a medical doctor, like my Oga mentioned, Dr. Adetoye, he spoke about conducive environment. Let me tell you something. The most important thing that is very paramount to a doctor is to get to the hospital, attend to your patient. When the patient comes in with a lot of pains, a lot of distress, and you are able to attend to the patient, the environment is so conducive for the patient, and you discharge the patient is walking back home smiling. That is the greatest joy of a doctor. Not necessarily the pain. While the pain is there, it is important. But when you are working in an environment where you can't even, you yourself, you are groaning, you are in distress, you want to attend to someone who is in distress, but yourself, the doctor, you yourself are in distress. Now, distress, attending to distress, it's not an easy thing, really. Like I said earlier, I salute those who have decided to stay, and it takes a lot of courage. And I know many people have the opportunity to relocate as well, just like myself, but they decided to stay for one reason or the other.
All right.
But those of us that left, I wouldn't say it's about patriotism. And many of us who are here as well, one way or the other, we have a way of giving back to Nigeria. We get into training. The world is now a small village now. The small village now over.
All right. We'll come back to you, Dr. Akonde. Quite interesting to see. If actually our producer can put up the two pictures Dr. Adetoye talked about earlier and see even the condition of the internet. No, I mean the two guests when Dr. Adetoye said, the situation. All right. But then the same question my colleague Daniel asked is what I will ask you. I remember we've talked about this patriotism thing before and allow Dr. Adetoye to speak on it as well.
Okay, thank you very much once again. Well, talking about patriotism, it makes me laugh when people talk about such things. People were not patriotic. They stayed back here for so long. Imagine himself now. He told us he had worked in Nigeria as a doctor for 13 years before leaving. And he told you the circumstances that led to his emigration. I have worked for over 20 years as a doctor in Nigeria. Over 20 years. This will be my 22nd year as a doctor in Nigeria. And a lot had happened, so I'd witnessed a lot. I love the story my brother told us, because that fellow said he was being patriotic, and if he had migrated to the UK, would have been one out of so many doctors. But in Nigeria, there are just 3. That means he's enjoying something. There's something he's holding on to here. He wants to be one of the 3 rheumatologists in Nigeria. So definitely, he can't tell me that is just born out of patriotism. It's born out of a pride of place for him. He's one of the 3 rheumatologists in Nigeria, which some other people, they don't have such portfolios to hold on to. And most likely, aside his official duties that hence him what you quoted earlier on, people will be calling him here and there. So he has a way of making up for certain things. Maybe that's why he's still staying back. And he could then pronounce that as patriotism. Laughable. But one thing is, like my brother said, we can't castigate anyone. Those who left, we call upon them from time to time to also assist us. But those who are in Nigeria, I feel now that they are fewer, now we have a ratio of about 1 doctor to about 9,000 to above that patients in Nigeria. They should be better remunerated, because now they are committing more time, they are more stressed. The system is even going down on them because the facilities are not there. So it goes beyond just talking about patriotism. Before anybody can be loyal to you, you have to be loyal to that fellow and to the plight of such a person, solving the problem of such persons. Outside this country, even in Ghana, you know what they did? They know their own economy is not also good. Things are very costly in Ghana. I know about that. But what they did was that they gave the doctors a special salary scale that made them to be able to cope with such. And that's what people are saying here. In Nigeria, when the government gives you 5 naira, they find a corner to take back 3 naira from you again. So that at the end of the day, you are left with actually practically nothing. And that's what is happening. And you can't blame people when they can't cope with simple things. How can you say that somebody who the family took every resources to take care of cannot even feed himself? I remember what Dr. Akonde was talking about. So many of our colleagues had to be depositing their certificates at the schools of their wards to as a collateral that, look, I will pay the school fee. Imagine when a consultant gets to that level. It was embarrassing. It was degrading. So they had to leave and do any other thing that will make them to be able to support their families. So in lamentation will not do this. They know what to do. They know how we compare things.
Dr. Adeto, before we go to the solutions, we want to have a clear picture. You are in Nigeria right now. Yeah. I remember last year, there was a newspaper report. I don't know if the condition have improved now, that in Lagos, in a teaching hospital, maybe Luth or something, and that a particular unit, the psychiatry unit, was closed down because there was no personnel to manage. I don't know if it has been resolved right now. And that, at the time, the report had it that unit had over 150 beds. It had to be closed down because there is no one remaining in that hospital. And that's talking about Lagos as at that time. Give us a sense. I know in the typical Nigeria parlance, you are one of the ones the doctors will call Oga because you're a consultant right now. But give us a sense of a day in the life of an average Nigerian medical doctor. What is it like?
It's as rough as I can describe it. You know, a lot of challenges. You know, recently the federal government also spoke about putting power supply to these hospitals so that there will be power and so many other things like that. But that has not significantly transformed things. And I don't want to talk about certain details now in the public space. But people who are coming around will know that that is not exactly what is happening. They are making effort. But for some other reasons, they couldn't get that through properly. So, you know, when you get to the hospital, the equipment are not there, this and that. Yeah, you see, let's put it in proper perspective. You need man, you need the machines. But like you said now that people are closing down, it's because those experts are no longer there. They are no longer there. And when you don't have them in the teaching hospital, then who will train the subsequent generation to become what those people became so that they can replace them? Even most of the young doctors that are graduating now, they are even not looking towards doing residency training again. They are just looking towards exiting the nation. So if you check the list of the examining bodies in Nigeria, National Postgraduate Medical College, West African College of Surgeons, and West African College of Medicine, you see that fewer people are applying for such professional cadres of exams. And so even most hospitals now are advertising for resident doctors. They want to employ through whichever means. But people are not applying. And speaking the truth, so many people are contacting us. If you have people who want to come into this field, nobody is showing up. And the few people that are showing up, you know what they are doing? They are just most likely just using that means as a means to an end. We can read it on their faces. And that's as you see, after 6 months, the fellow will just exit, drop in, a resignation letter and things like that.
All right, Dr. Adetoye. Dr. Adetoye, just before we go on this break, I'd really like to put this to you. Dr. Adetoye, you have been practicing in Nigeria for the past 22 years, according to you. Here's my question. Before I throw my question at you, let me just give you a quick background here. Interestingly, I've had a lot of wide interactions with Nigerian doctors. I mean, I've been given clinical presentations in many hospitals across Nigeria as a medical representative at some point. So I kind of understand what goes on in the field to some extent. Now, some doctors have been in Nigeria for a reason. For instance, the former head of Department for Hematology at the Lagos University Teaching Hospital, Dr. Dusomo, I had a chat with him, and he told me he studied in Romania. He said he came back to Nigeria simply because he doesn't see himself raising his children over there in Europe that he doesn't, I mean, agree with the lifestyle. He wants to raise his children in Nigeria. And he worked in Nigeria throughout his career, all through his career, right at the Lagos University Teaching Hospital, became the HOD for hematology, and he resigned. He retired, rather. So, on your own part, Dr. Adetoye, what has been your motivation? Why did you decide to stay back, despite all the challenges? You know, different doctors have their story. I'm really interested in yours. What really motivated you to stay in Nigeria, despite all the challenges?
Okay. Well, let me put it this way. I so much believe in the Nigerian project. Though I'm not a politician, I wonder why I so much believe in it up till now. But at a point in life, you can't be too sure again that I'm still as committed as I used to be at this point. Because a lot of things that I expected to have changed have not changed significantly. Like the minister said, so it's almost becoming an embarrassment to those of us who were holding the haze, believing that, look, no, guys, hold on. Things will change for the better. Well, for now, I am not too sure of what exactly is holding me back in Nigeria. I'm not too sure. And I'm not too sure that if by tomorrow something crops up, I will not leave as well.
Oh, so you are beginning to question your loyalty.
Yes, if that is how you want to see it, because in a situation where you don't even have followers again, you know, any system that does not bring up younger ones, you don't have committed younger ones. What are you doing? What motivated me to go into residency training and become a consultant was that I was seeing those who were going ahead of me, what they could do. I loved what they were doing and how they were impacting lives. But now I have to pass it on to the younger generation. And those younger generations are not forthcoming because they are seeing me and they can't see the best they want in me. In our own days, we saw some of our guys that we were looking up to. I want to be like this person. The days of Dr. Dosumu that you spoke about, things were not like this. At least he has something to come back to. He wanted to raise, and he has personal reasons as well. He wanted to raise his children in a particular environment. But now you want to raise your children in a particular environment and you can't afford school fee. You can't drive yourself to place of work. You are not secured. Today you are picked up, tomorrow you can't go to work because there's an obstruction somewhere. They are fighting somewhere. Even in the hospital environment, people are angry because you are there to deliver your own service, but what you will use is delaying the process, and the people will get angry. So, and that's not your fault.
All right.
So a lot of these things are discouraging. So that is the thing. Loyalty will always be there. Well, you see, if you are loyal to your nation, whether you are within that country, outside the country, you will always be loyal. And that's why people like my brother, Dr. Akonde, are giving back to the system. If he hears now in his department, back in Oshogbo, that they are having one problem or the other, and it's something they can solve. So many of them send things back. When we complain to them, see, this thing is granted, you see them coming together as an association and buying something and sending it down home to solve the problem. So if that is the situation, maybe so many people will also join them so that we can be solving the problem remotely.
Interesting one. All right. So much to really talk about. I'd like you to please hang in there, gentlemen. We'll go for this quick break. When we return, the conversation will continue. It's about this issue, this problem in our health sector. Stay with us.